Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Welcome to the podcast. Today I have the privilege of introducing Dr. David Bilstrom, a globally recognized leader in functional and regenerative medicine. As a renowned author, international speaker, and quadruple board certified physician, Dr. Bilstrom has dedicated his career to transforming the way we understand and treat autoimmune diseases. As the director of the International Autoimmune Institute and Bingham Memorial Center for Functional Medicine, he leads the first U.S. medical center affiliated with a teaching hospital that treats all autoimmune diseases while integrating nature's healing principles. His passion lies in reversing and preventing autoimmunity by focusing on root cause healing rather than symptom management. Dr. Bilstrom is also an educator, mentoring both individuals and medical professionals on the core principles of functional medicine. He is the author of The Nurse Practitioner's Guide to Autoimmune Medicine and the creator of the Autoimmune Paradigm, an experts program designed for clinicians. His groundbreaking work has taken him across 5 continents as a sought-after speaker, and in 2018, he identified and named Bilstrom's nuclearitis a crucial insight into immune dysfunction. I'm excited to dive into the insights and expertise and the future of autoimmune care. Let's give a warm welcome to Dr. David Bilstrom. Hi, Dr. B.
Thank you so much. Lovely to be here.
We're excited to have you. And before we get into the questions, I have to share with the audience that you really are the inspiration for this podcast. And that's the truth. I've been working with you for 5 years, and you are such an inspiration. And you've helped so many people, thousands of patients since I've worked with you. And it just really inspired me to want to work with other MDs and DOs that are open to functional and integrative medicine approaches and really, getting to the root cause. And, I just wanted you to know that you're an inspiration to me and to many others, and not just your patients.
Well, that's so lovely for you to say. Now you're going to get me all teary here on camera.
No tears. No tears on the podcast. But no, so it's just really an honor to have you on the podcast today. And you really are the inspiration for this. So I'm excited to dive in and let's let people know more about you. So if you could just tell us a little bit about your professional background and what led you to the world of functional and integrative medicine.
Well, my original area of specialty was as a rehabilitation doctor, and I specialize in spinal cord injury rehabilitation. So every patient that I'd see was either paralyzed from the waist down or the neck down. And it's a really challenging patient population. Every organ system in the entire body is affected by being paralyzed and the neurologic damage. But they are very sensitive to medication side effects, and truly, there's just not medications for most of the problems that they encounter. And so it got me really thinking, wouldn't it be lovely if there was something out there that could help these people, no matter what the health issue was, and wouldn't it be lovely if it had no side effects? And that's a pretty tall order when you're, thinking about more traditional Western allopathic medicine, where meds always have a lot of side effects and interactions with each other and all this. But what I came across initially was medical acupuncture, how acupuncture can help so many things, no side effects. And thus I ended up training at UCLA, becoming board certified in medical acupuncture about 30 years ago. And it worked so much better than I ever thought. You're kind of like, well, I'm used to using meds and surgeries and, a couple of very thin stainless steel needles, how much can that do? Oh my gosh, it was spectacular. And I had 11 rehab partners at a more than 200 bed rehab hospital, traumatic brain injury, spinal cord injury, stroke rehab, you name it, people with chronic health issues. And so I started seeing about 100 people a week pretty quickly with acupuncture, with all the patients we had to take care of. And it worked so well, it got me really thinking, well, what else is out there that I didn't learn in my traditional training? And I've been doing about a 30-year deep dive into all the things that they don't teach in medical school. And then from that point, I ended up getting board certified in integrative medicine, functional medicine, and seeing people that have been everywhere, tried everything, nothing's worked, come to me, including autoimmune disease. And after helping so many people already with autoimmune disease and these chronic health issues, I read this absolutely heartbreaking story in the New York Times about a really famous journalist who was losing both her career and her life to the autoimmune disease lupus. And her story is one I'd heard hundreds of times already. Doc after doc after doc, nobody knew what was going on. She was just getting worse and worse. And then eventually she gets a diagnosis. And the only thing they have to offer is kind of a bandage medicine that gets rid of, maybe helps you with a couple symptoms, but doesn't fix why you got it. So the why you get it just keeps rolling along, getting worse and worse. And when I read that, I just, I said, somebody's got to change the way autoimmune disease is dealt with worldwide, because this just is it's an epidemic already, and people just don't get the answers they need.
Wow. So when did you start practicing and treating functional medicine, for autoimmune diseases? Like when did that become your core practice?
Probably about 15 years ago. I'd already been doing medical acupuncture. I'd already been doing integrative medicine. And integrative medicine was very nice. You try to use more natural things rather than medications. And so rather than, let's say somebody has a sleep issue, well, here's all these sleep medications that so many people are on nowadays. And but just about every one of them increases your risk of Alzheimer's and dementia. And
Mm,
most of them don't. They give you sleep quantity, they give you a lot of hours of sleep, but they actually disrupt the quality. So they're giving you bad quality sleep, or some sleep's better than no sleep, of course. But in integrative medicine, you might say, well, rather than that, let's use valerian root. It's naturally occurring, no side effects, much more natural way to fall asleep. And that was great, especially when you're comparing it to these kind of medicines. But what really struck me about functional medicine was, well, if you can't sleep, and here's this medicine called Ambien. Well, it might give you sleep, but it's bad sleep and it increases your dementia risk. Well, that's not good. Well, valerian root can give you the sleep, but you don't have a valerian root deficiency causing your sleep disruption thing any more than you have an Ambien deficiency. So you're still not really getting at the root cause. Where with
mm,
functional medicine, it answers the question, why do you have something? Why do you have this thing that is, you want? And by fixing the why you got that, you make it, you improve it. But also that why that's probably making you not sleep is the same why that's making you tired or giving you joint pain or bowel issues or skin issues and all this other kind of stuff. So when you
sure.
really take care of the why of one thing, you're really taking care of the why of everything, and you can get everything getting better actually all at the same time.
Awesome. So you've been having fun for 15 years helping people. All
Oh,
right.
it is so empowering to know you could help people no matter how complex their issues.
That is amazing. And that leads to my next question. Can you share a story about a patient? I know you've helped thousands of patients, but one that really sticks out to you, whose life was improved significantly using functional or integrative approach?
Yeah. Oh gosh, I have a gazillion stories.
I know,
They're
but pick one that's really inspirational. I know you have that one, the mom that you helped. Do you want to
well,
tell that story?
that's the one I was thinking of. Yeah,
Okay,
because
yeah,
this
share
works
that
for
story.
children, this works for adults. And so there was this young boy who, right from the get-go after he was born, he had a lot of gut issues and a lot of developmental issues, developmental
Okay.
delay, emotional issues. And it kept building. By 14 months of age, it had gotten so bad, they took him to a major pediatric hospital, and they said, oh, well, he has celiac disease. He has an allergy to gluten-containing products, wheat products. Get rid of that wheat product, the gluten, and he'll be so much better. Now, celiac disease that he had is an autoimmune disease that's attacking the small intestine. On top of that, gluten-containing products, wheat products, are like battery acid bad. So you say, well, okay, well, he gets rid of battery acid, basically eating battery acid every day. He's going to feel better. Well, he didn't. And it just kept getting worse and worse. And then by 28 months of age, his gut issues were even worse. His cognitive emotional stuff was so bad that when they went back to the major pediatric hospital, they said, well, we're sorry to tell you, but he's got terrible autism. And there's nothing we can do. Terrible autism. And so they came to me, and the main problem that they came for was related to this autism, where he would have these, like I said, fits 10 to 14 times a day, where he tried to smash his head on the wall, smash his head on the floors. And the parents would try to restrain him for his own good, but he scratched their eyes out. So the parents actually came in with scratches on their face. And so, um, one thing I said is, well, you want to get rid of the foods that are bugging you, because they're creating all this inflammation and making everything worse. But you got to get rid of why the foods bug you. Why did that food start bugging you? They didn't ever do that. And so we said, well, we should be able to figure this out. We know why people develop food sensitivities. Is also, why you develop all autoimmune disease, all chronic disease. And so one thing I told them, they were just such a mess, and they've been everywhere already. I said, well, let's don't do anything until we test, because we don't like to guess. And so with the right testing, we're able to really pinpoint exactly what's going on, exactly why a person has the problem they do. And then sure enough, we started addressing that. And a year later, the kid was totally fine. The parents did a lovely video for us. It's called The 2-Year-Old Story of Celiac Disease, So Much More Than Gluten-Free. Is the mom was saying, well, my child back there at 28 months of age had all these health issues. That was just him really sick. My real child is this child a year later, happy-go-lucky, fun to be around, just an absolutely great kid. That's my real child with his system, his physiology corrected. And so, you got so many people with health issues. Well, that's just me. That's just how it's going to be. Well, actually, no, the real you is probably a really healthy person. And if you can figure out why you have what you do, there's no reason you can't become a healthy person or stay a healthy person in the first place.
That's amazing. What do you wish someone had told you when you first started practicing this way?
Well, I just never thought you could do this, because that's just not what I was trained to do. Yeah, I just didn't think you can make this kind of impact on people. And I was just hoping to help some of the folks that between my skills I had already, including medical acupuncture and that kind of stuff. There's still people that needed something. They just weren't getting as good as you wanted them to. Some people did great, of course, but I'm like, geez, what else is out there? And I thought it was just be one additional thing that I could add when other things weren't working. I never suspected that it could have this kind of impact. By actually getting at the root cause, you could have this profound impact on every organ system at the same time. And now, knowing what I know, like when you work with people that haven't had children yet, you're actually fixing their system, but they get to pass on cleaner health in the next 6 to 8 generations. We're talking, amazing impact on the person themselves. And if you do it before somebody has children, or you work with children before they have their own children, you're actually impacting the next 6 to 8 generations. And that just still to this day just blows me away that you can have this kind of impact. Now, I now know that the body is amazing. Its natural default mode is always to move towards wellness. And so, now that I know how smart the body is and how it functions and how it fixes things ideally, I'm like, geez, I should have known better. I should have known this was gonna have kind of impact, but it just seemed too good to be true.
Right.
And it is better, so much better than I ever thought it was going to be.
Well, that leads me to my next question. What advice would you give to other MDs or DOs who are thinking about adopting this approach to medicine?
It's not too good to be true. It's not what we're typically taught, and it's not the way we typically practice, but it is so enjoyable to take somebody who has been a lot of places, seen a lot of other people, nobody's been able to help them, and to the first day they walk in to have this unbelievable confidence, like, well, there's no reason we shouldn't be able to make this a ton better. There's absolutely no reason we can't make you feeling great. Some people get great quicker than others. Some people it's very fast. A lot of times it's slow and steady wins the race. But it is so fun to take people who nobody else has been able to fix, and really truly the person is kind of giving up some hope as well a lot of the time. Like, I don't expect much. If I could just, you know, get on the floor to play with my grandkids and get back up again, I would be the happiest camper in the world. And I'm like, well, there's no reason we shouldn't be able to achieve that, but we can achieve so much more. And just to see patients really realizing as they get better and better and better at how good they can get, and so much better than they ever expected. It's just it makes medicine so fun to go to office every day.
Makes it a very rewarding career, it sounds like.
Oh my gosh, it is the greatest. Yeah.
And we know that most physicians really do go to med school because they want to help people, right? I think at least a lot of them that I have spoken to, and the ones that are practicing functional, they say that that was their frustration that pushed them to go and to look for search for answers, to look for other, things because they were frustrated that they couldn't help the patients the way that they wanted to. So, yeah, I think this is kind of the missing link. Wouldn't you agree?
Oh, I would definitely say that, and what I kinda like is, um, just like we'd like to think in traditional allopathic medicine, everything is based on the science. Everything's based on, what's all these scientific data, and I think functional medicine is the most science-based way of doing medicine. I remember when I lectured around the world for acupuncture, is I would talk about things like, hey, a tennis elbow. Now, in traditional allopathic medicine, you might give them like Advil for the tennis elbow, and we go like, well, that seems to make sense. That's what my professors did in my training. That's what I'm doing. Back then, 30 years ago, there was no data at all to say that Advil helped for tennis elbow. No scientific data at all. Well, then if the Advil didn't work, you did a steroid injection. Well, that's what I was taught. That's what everybody's taught. There was no scientific data to support steroid injections for a tennis elbow, but everybody did it. It was just how what you learned. And it turns out that actually there was a ton of information about acupuncture working for tennis elbow, but there was no evidence for Advil and steroid injections. So in that situation, I would use an example. Well, the science behind acupuncture is so much better than the science behind these other things. And truly, 70% of everything that a doctor does in a traditional practice is really based on what you were taught in your training, and this is how it's been done. Only 30% is actually based on science. And
Right.
so it's not all science based. But with functional medicine, part of it is because we're doing things differently and we have to justify this. It is the science. It is the science,
Awesome.
including in my book that is made for medical practitioners, but it's also designed for people themselves, patients themselves. I included 100 different scientific references because
Awesome.
I thought it was very important that people know this is not somebody's opinion. This is the science. In my textbook chapter, there's 150 different scientific references. Everything we put out there, I'm usually going, hey, this scientific journal article from this date and all this is what it says. And so this is really the most science-based way of doing medicine. It's just science that most people don't know about.
Got it. Well, they're going to know about it now. And my next question for you is, what trends in functional and integrative medicine are you most excited about? Like, what's new and up and coming? Are
Well,
you seeing on the horizon?
I love our ability to reverse autoimmune disease. There's really an epidemic of autoimmune disease back when I first started doing that. And now we understand that immune system disruption, cancer actually being the flip side of the same coin as autoimmune disease. So everything we do to prevent or reverse autoimmune disease is preventing or reversing cancers of all kinds. I'm really excited about our ability to really help with everything, because it turns out the immune system is tied into everything. The immune system has to keep away the inflammation that drives chronic disease. And so it turns out in this last 10, 15 years, I've been specializing in autoimmune disease. Everything is autoimmune disease now. Now, unfortunately, there's an epidemic of autoimmune diseases that are the traditional ones. So everybody and the brother and sister gets autoimmune disease. But we now know that the immune system is vitally important when it comes to things like heart attack, stroke, dementia, Alzheimer's, osteoporosis. Even 70% of all autism is one particular autoimmune disease. And so what I love, I kind of should have seen this coming when I trained in functional medicine. I go, well, geez, you can fix anything. Well, now I'm kind of seeing, man, you really can fix anything. There's nothing, including autism. We see kids from everywhere with developmental delays and autism. Oh my gosh, it's not just that 2-year-old story we shared, but I mean, this is really, I think the trend is in functional medicine is actually that so many Western allopathic people are moving towards functional medicine, really getting this idea that wow, we can figure out the root cause, and we do it in kind of the way we would typically do it. We run tests. That's nothing weird about that. You run tests, you figure out what's going on. It's just that we're running different tests, and we have to be really good at interpreting the lab data, which is a really big thing, because you can run the right lab, get the result that's going to tell you everything. But if you misinterpret the lab results, you missed your opportunity. But now we really have a lot of tools in our tool chest to actually address these things and really get them to go away. I think one of the big trends is really getting at these central mechanisms. When it was come to integrated medicine and a lot of functional medicine, a lot of times I think was still kind of going after symptoms. Who could blame us? That's just kind of how we were taught. And so we kind of, oh, here's this, thing to help you sleep, but it's not going to be a sleeping pill. It's going to be melatonin, because you're probably deficient in melatonin. And we know the melatonin
Mm-hmm.
has this big impact on sleep, but it's also got other things. So I think what really exciting is we're really getting to understand, and this is like the autoimmune paradigm course you mentioned for medical practitioners, but also medical bill detox, which is our free 7-day educational email course for patients, where each one takes a deep dive into why people get these kind of things. And I think the exciting thing is we're really getting an idea of these central mechanisms that allow us to fix everything at the same time.
Mm-hmm.
Probably less use of supplements. We don't have to go chasing individual symptoms with supplements. We go after these central mechanisms, and everything is getting better at the same time, which is just I just think it's just wonderful to be able to do that.
That's amazing. So, that is a lot of information. And I will just tell people, since, I work with you, that, Dr. Bilstrom has created so much information and content for free on his website. Go to drdavidbilstrom.com, and that's drdavidbilstrom.com, to find out, find lots of information for free. He also wrote a book, which is The Nurse Practitioner's Guide to Autoimmune Medicine, and that's for all clinicians, not just nurse practitioners. Although, we originally wrote it for nurse practitioners, it works for all clinicians. And then if you are a physician in primary care or any type of specialty, and you want to be able to address autoimmune diseases, Dr. Bilstrom offers a certification course. So you actually don't have to go and do 2 years of fellowship training. You can actually take this certification and be on your way to helping your patients right there in your office. And so I just want to thank you so much, Dr. Bilstrom, for taking the time to be with us today. It's been an honor, of course, to work with you the last 5 years. It's been an honor to have you on the show. And I know you're going to keep helping patients and clinicians learn about all this amazing stuff, and wishing you best of luck always.
Thank you so much. My pleasure to be here.